Aloha, my name is Raisha and we are here at Lanai Community Hospital. We are kicking off our second annual Patient Safety Week. We are here to join with our staff members and nurses, doctors to check what they do here at Lanai to ensure patient safety. Hi Michael, we are here to visit your hospital and we're just here to check out on a few different tips that you guys do here at Lanai Community Hospital on patient safety. So we just took a temperature, and the reason for this is if anybody who comes into the hospital that has a temperature, that's a red flag for us, and that's something that we would avoid or something that would take caution in letting into our long-term care areas. Hi, we are here at Lanai Community Hospital with one of our nurse aides, Charlene. Charlene, can you share with us how long has it been since you guys had a last fall?
Over 7 months, we are fall-free.
We are here in the ED with Judith, our Director of Nursing. She's going to share a little bit about our medications here in this room.
Nurses and I also conduct an audit monthly to ensure that we are doing our part in complying to the policy and procedure of discarding our expired medications. So after we inspect them, if they're expired, we transfer them or remove them to another container. And we have a process of disposing them or discarding them.
Hi, we are here in our long-term care unit at Lanai Community Hospital. Here in our employees' badges, we have an identifier for those employees who took their flu shot. It's very important for our employees to take their flu shots to prevent spreading any type of viruses here at the hospital.
Hi, I'm Mariah and we're here at Maui Memorial Medical Center. We're kicking off the second annual Patient Safety Week and we'll be visiting different units and they'll be telling us all about their patient safety tips. We promote patient safety by meeting here every day at 9:15 to talk about patient safety issues. So what is it you do here in imaging for patient safety?
In imaging, we allow our two identifiers. So we check our patient's wristband to make sure that we have the proper patient, making sure that we're doing the correct body part. And then we also ask our patients if there's anything that we can do to help ease them or help them feel more comfortable while going through the imaging exam that we're going to be performing.
Nellie, as part of EVS, what do you do to practice patient safety?
Well, we practice patient safety every day, but properly cleaning and disinfecting common areas, patient rooms, and provide a clean and safe environment for all of our patients, staff, and visitors.
Thank you. What do you do here in the cath lab for patient safety?
For patient safety in the cath lab, we do our timeout process and also practicing aseptic and sterile techniques.
Thank you, Tony.
Here in the pharmacy, we use a process called dispense prep and dispense check to make sure each patient gets the correct medication. Mary is showing us an example of dispense prep. She's scanning a patient-specific barcode against each drug to make sure all medications are correct. We're here in the pharmacy showing you another example of dispense prep. Audrey, what do you do to ensure patient safety?
I scan all my medications and have my pharmacist dispense check them.
Hi, I'm Katie from the emergency room, and to ensure patient safety, I make sure I practice great hand hygiene and I ensure my patient railings are elevated on their beds. This is Brian from the emergency room.
Hi, I'm Brian. I'm also a nurse in the emergency room, and to ensure patient safety, I always make sure my patients have call lights and make sure they're working before I leave the room.
Tihani, what do you do here in the OR to ensure patient safety?
One of our main things is we do a timeout before every procedure. So we do one when we get into the room and we do a procedure timeout. And we have a script that we all follow. It's on the wall. Everyone in the OR participates. So it's surgeon, anesthesiologist, scrub tech, circulator. And we just verify that we have the correct patient, the correct surgery, the correct equipment, supplies. Everything that we need is in the room and ready to go.
Hi, we're here in OB with Napua, and she's going to tell us about what she does to ensure patient safety.
To ensure patient safety here in obstetrics, we want to make sure that mom and baby are paired and that they're identified correctly. So we have a mother's band, we also have a father's band and a baby band, and we use these bands to identify mom and baby and that they're the complete pair to make sure that there's no mix-up. And we also ensure safety by using our security tags for our babies specifically.
We're here in dialysis with Shelby, and she's going to tell us what she does to ensure patient safety.
So ensuring patient safety, we always check vital signs every 50 minutes on dialysis treatments.
We're here talking to Jen from Maui South, and she's going to tell us what she does to ensure patient safety.
Here on Maui South, a lot of our patients are high fall risk, so I make sure to always set the bed alarm on our fall risk patients and round hourly.
Thank you. We're here on Maui North, and Chrissy's going to tell us what they do here to ensure patient safety.
When we have a patient on isolation, we just make sure that we're wearing the appropriate protective equipment related to the patient's diagnosis.
We're here in Maui East, and Bar is going to tell us what he does to ensure patient safety.
So here at Maui East, we make sure that we do appropriate, adequate hand hygiene before and after we take care of our patients.
Great, thank you.
Thank you.
We're here on Haleakala South, and Rainita is going to tell us what she does to ensure patient safety.
Patient having a telemetry heart monitor, we have to put the 5 electrodes in the right place of the chest of the patient to get better reading or accurate reading for the heart of the patient.
Hi, we're here on Molo South, and Sharon is going to tell us what she does for patient safety.
So I'm a nurse on Molo South, and a lot of the times we get a bunch of surgical patients post-operatively. So those who have broken bones are here for a replacement. A lot of the times after surgery, patients can become dizzy when standing up, making them prone to falling. So we always have these gait belts handy, and it wraps around the patient just like this, and we'll slip it through. In addition to this gait belt, we'd also like to have adequate staff around just in case the patient may fall. But for patient safety, we'd like to have these around and extra hands.
We're here in rehab services, and Elizabeth is going to tell us what she does for patient safety.
In speech therapy, one of our procedures to ensure patient safety is making sure that we complete an evaluation within 24 hours and communicate all of the needs of the patient.
We're here on Molokini, and Kyle is going to tell us what they do to ensure patient safety.
Well, here on the Behavioral Health Unit, we check on patients every 15 minutes to ensure their safety.
We're here with Joel from the Maui Outpatient Clinic, and he's going to tell us what they do to ensure patient safety.
Hi, yes. Our goals are to get our patients seen within 48 hours of receiving their referrals. Patient access is something that we're really focused on and making sure that they're taken care of in a timely manner.
This is Nika from the Maui Outpatient Clinic and Surgery, and she's going to tell us what they do to ensure patient safety.
Okay, so what we do is that we track doctor's orders so that we can see the patient in a timely manner.
We're here with Niall in oncology at the Maui Outpatient Clinic, and she's going to tell us what they do to ensure patient safety.
Hello. We ensure patient safety by creating new relationships with different departments at the hospital to get our patients in under 48 hours.
This is Tamara from Ortho at the Maui Outpatient Clinic, and she's going to tell us what she does for patient safety.
So when we have patients that come in that need splinting, we check with the doctors to make sure that we're applying the correct splint to the correct limb.
Hi, I'm Rachel Cora, Manager of Emergency Services at Kula Hospital. We're here today interviewing staff about how they keep patients safe.
We're here at Kula ER with Connie, and she's going to tell us what she does to ensure patient safety.
We are currently experiencing a little virus outbreak, in case anyone doesn't know. And Kula is taking exceptional precautions. We now have a HEPA filter in our flu room. We are getting glass doors. We wash our hands. We are taking a lot of in-services on it. We're screening our visitors and anyone who comes into the facility. And I'm really proud to say that I think we're doing a lot to prevent the spread of the virus, which everyone knows about. I think that's an excellent thing that Kula is doing. I'm very proud to be here.
I'm here at Kula Hospital in the swing unit with Lillian, and she's going to tell us what she does for patient safety.
Hi, we always keep our bed at the lowest position, and we do hourly roundings.
This is Alicia from Kula Hospital, and she's going to tell us what she does to ensure patient safety.
I cook the food for the patient, and I make sure I have to do the right thing, put them on the good temperature, and of course, I have to make it delicious for the patient to eat. And I'm sure that they love it because every time nighttime, that's how I looking forward if they eating the food when the thing come down the tray.
This is Rex, an X-ray tech up at Kula Hospital. He's going to tell us what they do for patient safety.
Yes, I'm Rex. The main thing we do here for patient safety is to wipe the equipment down in and out. When the patient comes in, it's wiped down, and when they go out, it's wiped down. So each time it's cleaned.
Thank you. Thank you to everyone for celebrating National Patient Safety Awareness Week with us and for sharing how you keep our patients safe. On behalf of Maui Health System, we would like to mahalo each and every one of you for making this week a great success.